of headlines is again linking even moderate drinking to a whole bunch of health problems. We're talking as little as one drink a day for men and women, contributing to a higher risk of liver cirrhosis and several cancers, including esophageal and oral cancers. On the flip side, the report also links one drink a day to potentially a lower risk of a certain kind of stroke. And if you're confused, you're not alone. There's been a whole lot of alcohol-related news and guidance over the course of the last 6 weeks. Here are just some of the headlines that have come out about some of these studies. Dr. Natalie Azar is here to help us sort through this all. How are we supposed to be thinking about this? Is a drink a day, is a drink a day okay? Is a drink a weekend okay? Should we never drink? Should we drink sometimes? What would you tell your patients who come to you going, look, I have these 90 headlines. How am I supposed to make sense of it?
Oh boy, it's a lot, Hallie. It's a lot for anyone to consume. It's a lot for us also as health educators and to tell patients what to do, as well as studying our own behaviors and relationship with alcohol. I think it's triggered a lot of that for many of us. I think there's a couple of take homes. I think it is very clear in established science that alcohol is a carcinogen and it increases the risk of cancer. I also think it is true to say that if you are hoping to improve your cardiovascular health, you should not start drinking to achieve that. I also think it's very, very important for people to understand that alcohol is what we call a modifiable risk. That is to say that especially for cancer, it's behind obesity and tobacco as the third leading cause of preventable cause, I should say, of cancer. And that you have to take all of this into context. If you have someone who has hepatitis C and drinks alcohol, they're more likely to get cirrhosis. If you drink alcohol and you smoke and you're obese, all of those things are going to impact your risk of cancer. So everyone has to sort of do their own calculation, essentially, and decide what kind of risk they're willing to take in their lives and what risk they're not going to take in their lives. And if you really try to eliminate your risk for heart disease and cancer and all of those things, I mean, you basically are left with almost nothing, right? Because even small good things in moderation can potentially be bad for you.
Dr. Natalie Azar, capably done. Thank you. I feel like I understand it more. Hopefully our viewers do as well. Appreciate you. Thanks. NBC